Flu season is always a sure bet. Seasonal flu outbreaks can happen as early as October, but flu activity usually peaks between December and February, and some years flu season can last as late as May. The flu is a serious disease, and sometimes deadly.
There's a lot of missed days of work, missed days of school because of the flu. Over the last couple of decades, hospitalizations have been around 200,000 annually, and deaths from flu range between 3,000 and 49,000.
The good news is that the flu is vaccine preventable. The best thing you and your loved ones can do to avoid getting the flu this season is to get your annual flu shot. If you've had the flu before, you're unlikely to forget how uncomfortable and severe the symptoms can be. Symptoms include fever, coughing, sore throat, runny nose, congestion, headaches, body aches, chills, fatigue, and sometimes nausea.
Don't wait to get your flu vaccine. It takes 2 weeks for your body to build up a response, so while you might get vaccinated tomorrow, it will still take 2 weeks for you to have that defense.
You may have heard that the most prolific strain of flu that we have encountered this year is slightly different than the one that you can get vaccinated for currently. But this does not mean that the current vaccine is ineffective. Vaccination is still the most effective method of preventing contraction and transmission of the flu this season.
Flu vaccine is still the best way to prevent influenza. You should still do other things like, wash your hands, cover your cough, don't go to work when you're not feeling well. The flu vaccine is still the best way to prevent influenza. And number two is the vaccine is not a perfect match. It's a bit short of a perfect match this year, but it's still effective in preventing many cases of flu and still the best thing you could do. It may be more severe this year because the particular virus that's circulating tends to cause more severe influenza. When we're talking about influenza, we're not talking about a common cold. We're talking about an illness that can be really severe. We're talking about something that has a sudden onset and can give you a very high fever, has nasty complications, including pneumonia. People with influenza get very ill.
For those with a phobia of needles, a nasal spray vaccine called Flu Mist might be an option.
So it's available and recommended for children 2 years of age up through the age of 49, but is the recommended flu vaccine for kids ages 2 to 8 who don't have any other health complications.
For more information about your flu vaccine options and which one is right for you, or to get vaccinated against the flu, contact your healthcare provider or your local pharmacy. Those without insurance or with limited funds can call the CMAR Community Health Centers or the Vancouver Free Clinic to make an appointment for a low-cost flu shot. For more information about the flu, flu prevention, and vaccination, visit clark.wa.gov/publichealth/diseases/flu.html.